What is an ostomy? An ostomy is a surgically created opening where they bring a piece of the gut out onto the abdomen to allow urine or stool to leave the body. You usually have an ostomy because of bladder cancer, rectal cancer. They take the disease portion out, and so they have to provide you with a newer outlet. Other reasons that you have ostomies are from ruptured diverticuli. The patient may have had some kind of trauma, an accident that caused them to have a temporary. So they're not always permanent. Sometimes they can be reversed pending how the surgeon created the stoma and what they had to do on the inside related to the disease process or the trauma. So I'm going to show you an ideal stoma. Not everyone's looks like this, but this is what one looks like. This is a nice budded, it's red, it's moist, it's perky, and this is the kind that everyone would like. Here's another picture of a normal stoma. The color is great. We call that viable, which does mean that red and moist and perky, okay? So, but what do you do when you don't have that ideal stoma, okay? It's a different shape. It doesn't fit what the book says. So I'm going to show you another size of stoma. Okay, so this is a different shape. It's you know, a little bit larger than you know, some that you see. And then here's another one, which is kind of your ideal stoma on the bottom. What I do is I fit patients for these appliances. These are some of the items that we use. There's actually thousands of products for ostomies. If you're going to have an ostomy today is the time to have one, because we can find an appliance that's going to fit you where the ostomy is not the focus of your day. You really wouldn't think about it unless you had to empty it, because they make these products so good now. So in the world of ostomy, you have one-piece pouches, and that's what we like to call them, and then you have two-piece pouches. Well, this is an example right here of a two-piece, and this one's already been cut and placed over the stoma, and then you have the pouch, which would click and connect, and you can see this pouch you can't see through. So there's all kind of features when the patient gets past the first part and they learn the principles of pouching, that we start tailoring this to how the patient likes this and how this fits their lifestyle. And then you have a one piece. This is an example. It means it doesn't break apart. It's all together. And this one you can't see through it, but it has like a peekaboo opening where you can just visualize the stoma. We like to do that right after surgery to make sure that it's looking good and that nothing's going on with the stoma. I'm going to show you a couple of more. This is another type of two-piece. They actually come where you can even have them pre-cut, and then you wouldn't have to cut it to fit each time. And so this is another snap-on, and this has a Velcro closure instead of a clamp. So there's all kinds of options, and my job is to help you narrow down and get to the right option really quickly. This is an example of a one-piece, and this has a gas filter. So if you have a colostomy and you do have gas, then this naturally will let it out, and it has a charcoal filter that deodorizes, and so the patient doesn't know and people around you don't know when this is letting out the gas, so the pouch doesn't blow up. Okay? And then there's all kinds of other teaching that we do. We just don't put the pouch on, okay? We talk about living with the ostomy for travel, also for activities. You can see this is a person with an ostomy, swimming. So an ostomy is for living. We do a lot of emotional support, and we want to help you adjust to your new normal in living. So come see us and let us help you.